You should be prepared for anything when you go to and take your test. Remember, the board know what you're doing. They were going to adjust. It's like a chess match. When you adjust, they adjust. And they will give you things you've never seen before. They will give you a case without any diagnosis, no clue, but you have to be able to figure out what they're trying to do. So if you open your test and you see this, and they ask you, what is your management? They show you this, and they say, how do you manage this patient? It's a case form. Give them all the management that you need to implement for this patient. And they won't give you so much information. What is your management for this patient? What you need to do? What is your plan? What kind of content you need to be able to use to manage this patient? What would the patient, this particular patient, tell you? What exactly are they going to tell you? If it's a kid, what do you think they will be telling you? If it's a neonate, what are they going to be, the mother will be complaining about? So if it's an adult, assuming this is a 34-year-old male came in to the emergency room, what would this patient will be telling you? Right. Probably to tell you some fever, right? Some headache. Or you say probably some vomiting, right? These are signs you should be worried about. Or maybe some neck stiffness, right? Or the same patient, it can be a 4-year-old male, mother brought in. What do you think? Probably the same fever, will be some headache, some vomiting, right? And specifically, if they give you a young patient like that, look for a rash. That is the key. Look for rash on this patient. And they too, they may have neck stiffness. It's fine, but look for rash. They may not give you all of it. They will just give you rash. But don't forget, if they give you this sign, there's a reason why they keep giving you. It's a case form. It's trying to trick you. If it's a neonate, well, he can talk. What do you think the mother will be talking about? You say poor feeding, right? Or they'll call it poor suckling. The kid is not suckling well. If you examine the kid head, what are you supposed to see? For this particular problem, well, you're going to see some bulging fontanelle, right? I don't want you to memorize things, but be able to verbalize them. It makes sense. And when you see a question, they can trap you. This is the way the patient will present some of the symptoms, and this is something you will see, right? This is what you will see. If you see this is called, it's a sign. It's not something you treat, okay? This is a sign. You don't put pillow under the head. Don't do that. This is a sign. It's just telling you there's irritation of the meninges. You can figure out, well, based on what you see, somebody's examiner is touching the head of the patient, trying to lift their head, and you can see the knee and the hip is in a different direction. They're not doing what it's supposed to do. Why? Patient is having pain and is relieving the meningeal irritation by doing what? The hip and the knee are flexed. There's a word for it. So these are 3 patients you'll be seeing, and that's the way they will present, right? What is the problem? This is a life-threatening issue. Very life-threatening, and it's due to the inflammation of the meninges. Meninges surround your brain. So when there is inflammation, things happen in the brain. The brain basically gets bulgy, it gets swollen, there's no space anymore. and you start having manifestation of this sign, right? Adults will present this, peds will present like that, and the neonates will have poor feeding, poor suckling, and bulging fontanelle. How will you diagnose this problem? This is a 6 case studies, and you should be able to just do this easily. What do you want to do to make a diagnosis for this problem, right? This patient needs a lumbar puncture. Lumbar puncture. You have to know the position you need to place this patient in order to be able to what? Get the lumbar puncture, right? In most normal situation, they lay on their side laying. And after the lumbar puncture, post lumbar puncture is a priority. You got to prevent CSF leakage. So this patient has to be post lumbar puncture. It has to be in the supine position. Therefore, who do you see? A patient who had a lumbar puncture is still laying on the side. It's going to be a problem. There's going to be a leakage. You got to put them in what? In the supine position. That's number one. Your board also can ask you, what do you expect? What do I expect for this problem if I do a lumbar puncture? Okay. And that is where the trick will come from. Remember, this can be a bacterial problem or a viral problem. So you have to know what you're dealing with. If it's a bacterial problem, well, think about it like a UTI. UTI is dirty, right? So it's going to be cloudy. Right. That's what you see. UTI has a lot of WBC in, so elevated WBC. That's what you see in the CSF, right? UTI as what? If it's bad, you're going to have protein, but most of the time, because of inflammation, every time you have inflammation, there is some form of protein that you should see, high level of protein. So protein is elevated. Okay, this is a bacteria. They're going to ask you about glucose. Remember, there's bacteria there. Bacteria, what do they love? Glucose. They're going to take all the glucose from there. So glucose go down. So low glucose. This should not be something you should let the board take away from you. These are simple, straightforward questions. They will ask you, what do you see in it? So the glucose is going to be low. We're going to send it for culture. And out of the culture, we're going to grow some bacteria. And with that bacteria, we can give you specific antibiotic to take care of them. If they give you a viral, there is no WBC related to viral infection. What are the virus? Remember lymphocytes? Yeah, you see a bunch of lymphocytes. That's where you see. Mostly lymphocytes are elevated in that. So those are the keys. So if you think they're trying to trap you, no, they're using concept to give you the idea. So it will be a lymphocyte that will be elevated in the viral problem, right? What is number one thing for this patient you need to do for? That's the key. We got to protect this patient. But what are you protecting them from? You have to be able to know what is the biggest problem for this patient. With meningitis, irritation, just worry about ICP. Therefore, your management is all on ICP, right? Quiet environment. So you're going to put them in a place where it's very, very quiet. Okay, very, very quiet environment. Right? Avoid excessive stimulation, right? If you need to darken the room, okay? so that you don't disturb them. Their head has to be 30 degrees in order to maintain their ICP. Okay. You want to make sure you avoid coughing, sneezing. All these things going to affect their ICP. So those are the things you tell them. Don't bend. You cluster your care in order not to overstimulate them too much, and that will increase their ICP. Because if that happens, they are in trouble. What else should you worry about when it comes to this particular patient? The seizures. These are complications. So you got to institute seizure precaution. This is very straightforward. Seizure precaution. What are the things you do? Your bed in the lowest position as much as possible, right? The pillow under their head so that they don't bang their head. All 4 rails. They are up and padded so that they don't get injured. Okay? You should have suction and oxygen at bedside. This should be something you'll be able to recite easily. Suction at the bedside, right? As much as possible. Those are the things you try to do. And then side laying. Make sure they're laying on their side so that they don't injure themselves. So that's another thing you should be able to do to prevent that. You got to loosen their clothes. So no restrictive clothes. So loose clothing as much as possible so that it doesn't choke them when they are getting into trouble. Now, I've talked about everything. I intentionally left one thing because that's what most people forget about. This is the key. The key is what? Droplet percussion. Most of this is caused by Neisseria meningitis. It's Neisseria meningitis. Okay, or it can be caused by strep, pneumonia. So those are the most common organisms that you will find for this particular problem because of that. Okay, because of that, you have to institute droplet precaution. Don't let them trap you. For droplets, what do? Because of the organism involved, all you need is surgical mask, usually between 3 to 6 feet from the patient. That's the key, 3 to 6 feet from the patient. So why will you have to completely close this door? It does not. It may. That you watch for these words they put in the question. These are traps. May be closed. Their door may be closed because you have to be between 3 to 6 feet from them to get the infection. So if I'm walking outside in the hallway, I'm not going to get anything. There's no need to close door completely for patient who is on droplet precaution. That is the best thing. That's how they can trap you with that. The door may, the word is may, but not must. Must be closed, right? This is surgical mask for who? The nurse, okay? This is for the nurse. Patient wear no mask in the room. The only time the patient wear mask is going out for X-ray or is in the hallway. That's all. Anywhere, surgical mask. It's not N95. You don't need, no need for negative pressure room. You don't need negative pressure room. So there's no need for that. You don't need to wear a gown. Okay, I'm intentionally giving you this because that's what people get. You over-select when it comes to infectious disease. You don't need, so no gown, okay, no gloves, because it's not part of the precaution for droplets. When they put all these things there, they're trying to trap you. When they say what kind of PPE you need for droplet is specific for that problem, specific for that infectious control. They're talking about whatever will cause the bacteria to be transmitted to another person. If I wear gloves, it's not going to affect me because it's not a contact problem. So why do you want to select gloves and gown for a droplet problem? I know you want to protect yourself, but it does not include transmission. So when they give you those questions, they're referring specifically about transmission protocol. So anybody on droplet, when you wear gloves, it's not going to do anything. So it's a wrong answer. If you wear gown, it's a wrong answer. The only thing that is protecting you from the transmission is what? Surgical mask. So don't over-select. And it's very confusing, but just try to pinch yourself and you say, what is going to cause these bacteria to be transmitted to me? The only thing is gloves, is a mask. That's all. The same thing. If it's airborne, the only thing that will prevent transmission is what? N95. It's a contact, it's gown and gloves because I'm touching it. So don't over-select when it comes to this kind of problem. And then they will give you select or apply, and then you make a mistake. And so don't do that. This is just me giving you those facts in order to help you so that when you go to the Q banks, you see they put all these multiple choice to like trap you. But pay attention to the question. When it said transmission protocol, that means whatever is going to prevent the transmission is that. So all you need is the mask. That's all. Right? So that's the key thing you have to worry about this particular problem. Pay attention to the seizure protocol, ICP, and all the things you need to do for this particular patient. Once again, this is the problem we're seeing. What is it? What kind of sign is that? This is the case I gave you. Somebody with his neck flexed this way and his hip and his knee in that position, all flexed. What do you think is this sign for? You should be able to figure it out and be able to know what they're talking about, right? So this is, they call it Brudzinski sign. So it's just a sign. It's nothing but a sign, okay? And what is that? It's just irritation of the meninges. And then you should be able to describe it. Sometimes they describe it to you. So don't worry about it. The other one is Kerning sign. So the way to remember them is because these has a knee in it. So Kernin, the NN over there, basically I use it as a knee. And so all these signs is just basically is different. The neck is not going to be extended for that one. So this one is basically the flexion. When you flex the neck flex is going to elicit some pain. Okay, when you flex this patient neck, there is pain. In order to relieve the pain, they're going to extend, you see, extend and flex the knee. So you have the hip and the knee all flexed together in order to relieve the pain. And that is the Brudzinski. It's mostly hip and knee flexion to take away the pain from the neck. For the Kerning, you won't be able to extend all the way. The hip will be flexed, but it will be locked in place at 90 degrees, and they will have pain. That's all. So knee extension will be locked in place because the hip, when it flexes, it causes a problem. That is the two difference between them. And those are signs. When you see it, it tells you that there's irritation of the meninges. So what is this guy's problem? You know he has meningitis. What do you need to do? Droplet precaution, lumbar puncture, ICP precaution. These are safety questions that you should be able to like answer it easily. ICP, you know, make sure there's a quiet environment no coughing, making sure you're not disturbing them, you don't suction them when they need it. You do things that will not stimulate them too much. Of course, you got to get the culture and figure out what the bacteria is and treat it. You get lumbar puncture before you give them antibiotic. One thing you have to know, people always forget, is about prevention. How do you prevent this? That's the key. How do you prevent recurrent disease of meningitis in a patient who comes in and he has meningitis? How do you prevent it, the future prevention? What do you guys think? This question is for you guys. So what would you guys want to do for a patient like that come in and you know they have meningitis in order to prevent future infection? What do you want to do, guys? What do you want to do? Do you vaccinate the client? Vaccinate the family members? Vaccinate those friends? Those are your multiple choices. Who do you think need to be vaccinated to prevent future problem? Who need to be vaccinated? Who need to be immunized? 3 options. Who do you want to select to immunize? Who do you want? Because that's very important. Who are you going to vaccinate? Because that will be part of your question. That you should be more to prevent future problems. Who do you think you need to do that? Who are you going to do? That's the key. I'm waiting for an answer, then we'll be done. So who? The client, their family, or the friends? Who do you think need to be vaccinated? And this is a concept that you have to pay attention to. So the person you need to vaccinate, family members, and close friends. The client does not need to be vaccinated anymore. The other thing you need to know is don't let them trap you. If you come in with viral meningitis, and I come in with bacterial meningitis, this is a different problem. It's completely different issue together. Your management is the same, but there's one management, you should not confuse them together. Viral meningitis is different from bacterial meningitis. The organisms are different. Precautions are different, and that is the way they will trap you. Just because you see meningitis doesn't mean then you select the answer. Knee-jerk reaction. No, don't let them trap you. A viral meningitis is what kind of precaution? We just talked about bacterial meningitis. What kind of precaution do you, standard precaution, or what kind of precaution do you institute with this problem? We know bacterial meningitis most of the time is droplet. This is not droplet. Okay, bacterial meningitis is a standard precaution. Therefore, when he asks you, what do you do? Don't say you're going to put them in isolating private room and isolate them. Wrong answer. Okay, that means you take all the standard precaution you need. But if somebody will ask, what is standard precaution? Well, you wear a glove gown. No, for your test, unless they want you to tell them specifically, this patient, they won't try to trap you, but just know this patient go into a standard room. It does not need to have a private room. The door does not need to be closed. You don't have to wear a mask going to see that patient. Just standard precaution for bacteria and for viral meningitis. Don't wear any mask. Don't wear gown, gloves like you're trying. It's just a standard precaution. Unless there is something that is going to affect you, they have a wound you're going to touch, it become what? A contact in addition to standard. Then you protect yourself against the wound. Just to let you know, so that they don't trap you. Once again, meningitis, inflammation of the what? The meninges. You present in different form. A kid who have bulging fontanelle, who are suckling, peds, what would they have? Fever, headache, vomiting. Look for the rash in their neck, and stiffness. Older patients, the same thing. Fever, headache, vomiting, neck stiffness. When you examine them, you're going to see the sign, Brudzinski sign. And what is that? It's basically neck flexion, and then it will elicit pain. And when they have pain, what would they do? They're going to flex their hip and knee to take away the pain. That's why they're doing that. Nobody wants to keep their leg that way. They're doing that to prevent the excessive irritation of the meninges. The other way, if you extend their leg and the hip is flexed at 90 degrees, it will be locked in place and it will cause pain. That is Kerning sign because of the knee, K-N-E-E, Kerning sign. That is different. What you do lumbar puncture, know what you're supposed to have in the bacteria and the viral. Bacteria is going to be cloudy. You have high opening pressure. The white count will be elevated, high protein and low glucose. Bacteria viral look for lymphocytes. What is the complication? ICP issue. What should you worry about? Seizure precaution. Okay, so know all the safety precautions about seizure. Infectious control, droplet. And the droplet, surgical mask when you are 3 to 6 feet away. The door does not need to be closed. You don't need to wear a gown, gloves, and all the things they try to trap you. If it's a viral, nothing, just standard precaution. Remember, these are straightforward questions. Your board will try to hide it. They will give you a picture like that. And then they want you to go through all the cases without not telling you what you're dealing with. Stick with your guy. When you make the diagnosis and you know it's meningitis, keep on going and going and going and answer the question related to meningitis. This is ADAPT NCLEX. Thank you for watching. Take care of yourself. Keep charging as always. Master your content and you can conquer NCLEX any way you want. Take care of yourself and bye. Thank you for watching.